Now, one of the other pieces that you wrote that I thought was really interesting, you were taking a look at some of the literature in terms of how I think there were a couple scales you were taking a look at. And one of them was actually you had kind of gone into how they were being written in advance. It was like the assumptions were embedded into it as they related to men and men's privilege. And I was so curious if you recall the piece you were referring to and what you've seen, because all these and we talk about it at CTA as well, embedded assumptions that can show up in clinical, surveys or clinical work. The historical or common example is like, how often do you do X? The assumption's already embedded in the question. What kind of things were you seeing in your research?
Yeah, so this was an essay that I wrote for Reality's Last Stand, which is
Mm,
a really great Substack page critiquing a lot of this junk in academia. And that particular essay, the title I can't remember, but it has something like rigged woke research in the title, something like
mhm,
that. And I've been reflecting about that piece a little bit more lately, and I think it's probably one of the more important things I've written this year. The reason for it is because it's sort of at the heart of science, the heart of academia. What I have been noticing over the past few years is this concerning use of interview and focus group research to push forward an agenda rather than communicate objectively what it is the research participants are saying. So in that essay you're talking about, there's two different kind of papers that I critique, or two different areas. So the first one was a paper that came out on the concept of white ignorance. So this piece was a interview focus group study of, even more concerningly, adolescents who were asked questions related to racism, and they were all white adolescents. And if you look at some of the focus, the limited number of actual quotes that they provided from the participants in their paper, you'll see that the kids aren't racist. They're saying, "Oh no, I don't view people based on their skin color, nothing like that." And these were actually very encouraging responses from the kids. But instead of viewing it that way, what these researchers did is they said, look, this is evidence of their white ignorance. Look how ignorant they are of their own white supremacy. I mean, to me, that is just truly appalling to do that. Um,
mm,
so that was one piece. But
mhm,
then
mhm,
same thing is being done in kind of the men's health and feminist space. So there's another paper that I talk about, and it was an interview study of men in Canada who are involved in fathers groups. And it was a complete setup job, just like that other paper was that I just talked about. So the guys, they gave heartfelt responses to the questions they were asked to answer. They said, look, we come here sort of for solidarity. This whole notion of us as men being privileged and everything, I don't know what the heck you're talking about. Like, we feel very powerless right now. And one reason we like these fathers groups is it just gives us people to talk to and we can share our experiences. It was just the most genuine sort of thing you could ask for. And this male feminist researcher in Canada essentially took everything they said and turned it against them and said, look, this is backlash against gender equity. It's backlash against feminism. And the thing is, in both of these papers I'm referring to, you can see in the methods section, they come out and they explicitly state that prior to starting the study, they were coming in with a particular
mm, mm,
epistemological lens. So they never had any intention of an inductive process where they take the responses from the participants and they just build themes upward from there. Instead, what they do is they have a pre-existing narrative, or lens as they call it, and they cram all the responses in to fit that. So not only do I think that is poor science, non-objective science, which is why I'm so concerned about this trend, but I actually think even deeper than that, it's an issue in the ethical conduct of research, because part of research ethics is basically like do no harm, right? Or minimize harm. Well, if you already know prior to the study what your conclusion is going to be, so that white ignorance exists and that these men are kind of anti-feminist problematic men, then there is no justification for you even conducting the research, because you already know what you're going to conclude. So why expose those participants to any risk of emotional harm or physical harm